Yes. I'm not concerned about the capacity because we are a health service with over 10,000 beds. What I'm concerned about is the amount of virus each person has, and we are seeing very low cycle times for a lot of these people. That means they've got an enormous amount of virus. We didn't see that early in the pandemic. They were different variants, and we didn't see that amount of virus. So we know the risk is extraordinarily high, and we are getting more and more of these extraordinarily high risk patients in our hospitals. And it is so easy for one tiny error to lead to contamination of a healthcare worker. So it does worry me that we've got over 80 cases in our hospital system that we're having to manage, and they are such high-risk cases. That's why it is so critical that we've been given that go-ahead for the next 2 weeks to halve the numbers of travellers coming into Queensland. But again, today we saw 9 positive cases. So that, of course, only came into being midnight on Tuesday night. So yesterday we had the halving first come into place. So we won't see that spell out for a few more days in terms of cases. But it's critical for us. It is a concern that we've got so many infectious people in our hospital system. At the moment, I have 2,742 contacts. Not all of them are in quarantine. Some of them have been asked to test and isolate till they get a negative result. So not all of those are in quarantine. We have 118 exposure sites, which you can go onto our website to see. Some of those exposure sites mean you've got to go into quarantine. Others mean you've got to be tested and isolate till you get a negative result. Yeah, we're continually adding because this is really tough on people, and these cases have been brilliant. We've now got 8 related to the first cluster, 12 related to the second cluster, and people remember things, and they are so good because when they remember things, they come and tell us straight away, and then we put that information on our website. So thank you for reminding me. Could everyone please continually go and just check that website and just check if you've been to any of those venues. Of course, those people who've been putting their information in through one of the apps or giving their details, we contact them as well. But also for people who haven't put their details in, if they could just come forward and get tested, that's critical.